is a broad term that generally refers to the unexpected loss of an infant in the early stages of pregnancy. Whether this loss was through stillbirth, miscarriage, a neonatal death, a failed embryo transfer, or a spontaneous abortion, the experience can still be a traumatic life event. My name is Sana Chaudhry, and I am a registered psychotherapist qualifying, and I will be touching on the topic of pregnancy loss and grief. I will also be sharing some coping strategies and resources. As we experience life events and transitions, we also experience a vast array of emotions. Speaking particularly towards pregnancy loss, oftentimes witnessing such a death can be unexpected and quite sudden. Going through such an experience can leave one feeling shocked, confused, angry, guilty, sad, and in pain. You see, even though you may have lost other family members or friends, you were able to share that grief by talking about it, by posting it on social media, and receive support. But for couples who are facing a pregnancy loss, they may not have received that same outpour of support because it's a very personal and intimate loss. And not everyone is able to openly share, nor might they want to. It's also worth mentioning that although these individuals may not have had a relationship with their infant, the loss can still have psychological impacts on parents. To name just a few mental health issues that can arise: depression, anxiety, sleeping disorders, and post-traumatic stress. It's important to recognize that there is still an element of stigma associated with pregnancy loss. Even though miscarriage has become so common, it is still so difficult to talk about it. There have been more and more couples who are struggling with infertility or undergoing fertility treatment, yet they are struggling in silence together because it is also something that is still stigmatized in our society. All of this can be such an isolating experience. Individuals and couples more often than not try to minimize their emotional response because they may carry feelings of guilt or shame, or simply not know how to process the journey. They might not know how to react. They struggle with figuring out who they can share it with and how that person may react. It's difficult because when they turn to the internet for information, they are overwhelmed with information that may or may not be true. Grieving after a pregnancy loss is a very intense and individualized experience. Just imagine going to the hospital pregnant and coming home without a child. Of course, you are going to feel terrified and confused, sad and angry and in pain. The grieving process for pregnancy loss can last anywhere from several months to several years. So it's really important you receive the right form of support. Symptoms of grief can include, but are not limited to, lack of energy, fatigue, physical symptoms such as headaches and gut-related issues, not sleeping enough or sleeping too much, overworking or excessive activity, feelings of irritability, feelings of isolation, depression, anxiety, feelings of anger, and sometimes even questioning faith. A well-known psychiatrist that goes by the name of Dr. Kubler-Ross proposed 5 stages of grief that we in the therapy world use to break down grief. The 5 stages are denial, anger, bargaining, depression, and acceptance. These stages don't necessarily have to happen in this order. In fact, some may be intertwined, depending on your circumstance. It is important to remember that everyone grieves very differently. So some individuals may experience all 5 stages, while others may not. Denial is usually the initial reaction to the loss, so some individuals may experience this longer than others. Anger might emerge and may be directed at the deceased or a partner or a close family member or sometimes even God. You may feel pain or resentment because of the loss. Bargaining is when feelings of helplessness and vulnerability might start to seep in. So you might find yourself trying to make a bargain or a deal, for example, with God or a higher power. Again, this is a normal response to the pain and guilt that you might be feeling. Depression can show up in various forms. Sometimes this is through sadness and regret, and other times the symptoms are more prominent and may last much longer. Either way, it's always a good idea to touch base with a health professional that can offer you the support that you need. Some of the thoughts that may seep in at this time can in fact be very harmful, and it's best to get help sooner than later. Lastly, acceptance. Acceptance is when the individual has understood that their loved one is gone and is able to move past anger or denial. They have learned to make peace with the matter and try to make space in their lives for happiness and calmness. The individual is able to come to terms with what has happened and has found a way to move forward. I wanted to share some coping tools and strategies that can be helpful with the grieving process. Journaling has proven to be helpful time and time again. It is actually one of the tools that most therapists recommend using, not only when times are tough, but even during the good times. Journaling can really help you work through your thoughts and feelings and provide you a safe space to organize your thoughts in a meaningful way. It can also make for a learning experience in that it allows you to recognize and observe the feelings and thoughts and notice any behaviors or patterns. Talking to a loved one or finding support groups. I know this one might be difficult if you do not feel comfortable sharing your loss with loved ones, and that's completely understandable. But remember, by sharing, you receive support, and by receiving support, you start the process of healing. If this is something that you do not wish to share with friends and family members, perhaps look for support groups you can join and talk about your loss with. It may even help for you to process your thoughts and emotions when you're able to hear or talk to others who have shared similar experiences as you. Sometimes by sharing our stories, not only do we receive support, but unknowingly, you might be giving another individual or a couple the support they just needed. Lastly, setting realistic goals. These goals are those goals that are specific, relevant, obtainable, and something that is measurable or time-bound, so that not only can you hold yourself accountable, but also feel a sense of achievement once you've completed them. In a moment where confidence and self-esteem may be shattered, setting and achieving these goals, no matter how big or small they are, can really help. So when to seek help? Research has shown that receiving support for pregnancy loss and taking advantage of grief counseling can really help to reduce mental health symptoms such as long-term depression and anxiety. It is important to understand and accept the reality of the loss. It's important to identify and deal with the traumatic experiences. And it is important to be able to talk about all of these sensitive topics in a safe and supportive environment. Some misconceptions about grief counseling are that the therapist will make you forget about the individual you have lost, or that you won't experience any pain or grief, or that it may change you and make you forget about your past altogether. None of these are true. In fact, grief counseling can not only help you experience the loss, but also can help you to find meaning and purpose as you heal and move forward in life. Sometimes this includes finding ways to celebrate and remember the individuals that you have lost. If you have recently experienced loss or are grieving, it is important to reach out for help. The right professional, such as a counselor or a psychotherapist who specializes in pregnancy-related issues or grief, can really help you to understand the stages of grief and loss, can help you to process your emotions, thoughts, and feelings, and can help you to create a plan to move forward. Here are a list of resources that I have shared. These resources not only have booklets and information on pregnancy, loss, and grief, but a lot of them also offer support groups. So that might be helpful if that is the route that you would like to take. Sunnybrook Hospital, Baby Steps, Center for Loss in Multiple Births, Subsequent Pregnancy After Loss Support, and then the Ontario Prenatal Education. I also wanted to include how to find a therapist or a counselor. So the two well-known websites are psychologytoday.com and then goodtherapy.com. these are the two most recommended websites because you can actually search through keywords. So typing in pregnancy loss and grief, you'll be able to find counselors and therapists that specialize in this field. You're also able to ask counselors and therapists whether or not they offer a complimentary consultation. That's a great way to chat with a therapist before your sessions begin and get to know them and see whether or not you feel they would be a good fit for you. So I would just like to take a moment and say thank you for listening, and I really hope that you found this information helpful.